I'm Dr. Sarmishtha Bandopadhyay, Consultant ENT Surgeon at Neotia Mediplus, Rawdon Street. As you know, ENT is a subject which comprises of ear, nose and throat. I would be talking about some ENT problems today for which the patients usually self-medicate or search for medicines, search for over-the-counter medications, and they seldom visit us. To start with the ear, patients, they almost always do a self-cleaning of the ear canal. And sometimes we face lots of problems when they try to clean their children's ear. You should not be cleaning your ears. Why? Because the wax, which is scientifically called cerumen, this is a secretion from special glands called ceruminous glands, which is situated only on the outer part of the ear canal. And there is a self-cleaning system which is given by the nature, that is a migratory system through which whatever debris is there inside the canal, that comes out automatically with the movement of this joint. We talk, we chew, it comes out. If you try to clean more, there would be more accumulation and you are likely to injure the structures which are very, very important. We often encountered when the parents try to clean their children's ear, they have landed up with lots of lacerations in the ear canal and even perforation of the eardrum and damage of the ossicular chains even inside. Coming to the second topic, which is putting or installation of the eardrop of your own. There can be 100 diseases inside the ear and there can be even more eardrops. You do not know the combination and you do not know the disease. So what happens if you put the unnecessary eardrop? That does lots of harms to your ear. What? Like, first of all, even if nothing much has happened, it can drag the dirt from outside and goes in where it's supposed to be clean. And secondly, what we encounter more often, that when the patient is having some pain in the ear, especially children, you go and ask your pharmacist and actually give the wax solvent. Then what happens? The child might not be having wax in the canal and the eardrum is inflamed and it's ballooned up because of an middle ear infection. Then if that drop, which is corrosive enough to dissolve an impacted wax, falls on an inflamed eardrum, it can even rupture the eardrum. So for God's sake, do not decide what eardrop to be put inside the canal by yourself. It should be only by the jurisdiction of the ENT surgeons. Coming to the other parts of my specialty, like nose. There are people who forcefully blow their nose. That's very bad. And that can even invite nasal bleeding and epistaxis and even lots of trauma to the ear. Secondly, while having epistaxis. Epistaxis is something which is the scientific term for nasal bleeding. In epistaxis, many of you actually press the nostrils tightly and put lots of eyes and everything and handkerchiefs to stop the bleeding. That should not be done. Number one, because that invites panic to the patient. And whenever the patient is panicked, it is more likely that the bleeding would increase. Rather than if you make the patient lie down with a little bit head up, like 15 degree or 30 degree head up, and patient can lie on a lateral position with a bowl where the bleeding can be dropped, or the patient can sit in a relaxed position, slanting and having any container through which where the patient can actually spit the blood out. Rather than what you should be doing, you can rather use eyes, but the eye should be used in the bridge of the nose, where from actually the blood vessels are generated. Or the best is what we are doing nowadays, you just inhale cold water. Just take a small amount of cold water in your palm and try to inhale the water, because most of the epistaxis, most of the nasal bleeding starts from the front part of the nose, what we call as anterior epistaxis, and most of the anterior epistaxis can be stopped by inhaling cold water frequently. The last topic which I want to emphasize, that is when to gargle and when not to gargle in throat infection. When you are having a throat infection, which is basically pain in the throat and you cannot swallow well, you are having fever out of that, you can gargle. But there is, if there is pain and hoarseness of voice, any voice change, you should not be doing gargle. Because when the voice is being generated by the vocal cords, which are very tiny organs situated in almost in the mid of the neck, at the gateway of the airway, inside the larynx, and that is the only organ in our body that is basically producing the sound. So whenever we are doing gargle in throat problems, we are actually irritating the vocal cords. So if you do not gargle and if you take warm water, that is always best, because that would actually take care of your pharynx when you are having a tonsillitis, and that would take care of your larynx when you are having a laryngitis with hoarseness of voice. Thank you so much.